The following portion of Great Day KC is sponsored by USA Vein Clinics.
It's something that affects up to 17% of men and up to 40% of women. We're talking about vein disease, and our next guest puts patients first because they believe you deserve a trusted and compassionate partner to discover the problem and help you on your treatment journey. Dr. Katsnelson is the CEO and founder of USA Vein Clinics. Good morning, doctor. How are you?
Good morning. Thank you for inviting me.
Absolutely. So what is vein disease and how many Americans does it affect?
Vein disease is a problem with the circulation. There's two parts in circulation: arteries that bring fresh blood and veins that take the used blood, kind of sewer of the circulatory system. And when we have a congestion in the system, broken valves, then we have many problems. And up to 18 million Americans suffer from this because when blood cannot return, used blood cannot return towards the heart and lungs and rejuvenate and come back as a fresh blood, we have a problem with the circulation.
Oh, wow.
And it's very, very important things that everyone needs to be aware of.
Absolutely. So speaking of just being aware, what are some of the common symptoms or signs of vein disease?
It's a great question. There's two types of symptoms, two reasons. One is because of congestion, right? Because, we have congestion and we have swollen legs, bulging veins, we have heaviness, but there are also symptoms of poor circulation when skin and legs already don't have enough oxygen, don't have enough nutrients, and that's pain. It's itching, burning. It's a cramp, especially night cramps. Even when skin becomes discolorated and thick and eventually wounds. About 1 to 2% of Americans above the age of 65 in Medicare age have wounds from vein disease, especially when they scratch and bump in something, and especially if they have diabetes, they don't even feel this bump, and they look at this, oh, I had a bump. A week later, those patients have wounds. So it's very serious disease. Both congestion and nutrition are the dangerous things that needs to be treated.
Yeah, definitely. So, doctor, tell us what are the common misconceptions or myths that people have about vein disease?
Vein disease are very common. Almost everyone has some spider veins, and people start having varicose veins. And because it's common, we think, oh, it's common, it's normal. But it's not. Interestingly enough, even asymptomatic venous insufficiency increased risk of clots in deep venous system, what we call DVT, about 5 times, even without symptoms. Also, people think it's a part of kind of getting older. The tiredness of the legs, the heaviness, we just get old. That's not true. It's just because we develop congestion and venous insufficiency. There's some misconceptions that maybe if I can put some ointments, I change what I eat, things will change. Arterial disease, cholesterol, that depends on the diet, but veins really not. It's a mechanical thing, mechanical problem when veins are stretched and the valves, like double doors inside, stop connecting to each other, and there's a leakage. Think like in a basement, sump pump, when the valve is broken, all this water goes in and basement is flooded. Exactly the same things happen with the leg, and it might cause serious illness and serious consequences.
So how is vein disease treated? How long does it take for that procedure? And then, of course, what is the recovery time after you get it done?
That's the best news. So about 20 years ago, it was invented what they call ablation therapy. All treatments were stripping, surgical removal of the bad veins. And 20 years ago, we created ultrasound-guided a procedure that we can just put a tiny catheter that hits the vein under local anesthesia and close. In the last 10 years, other technology were invented when we can do things through tiny needle hole without even anesthesia because it's painless. Usually procedures last between 5 to 15 minutes, and people can go home right away. Some procedures require compression stockings for a few days. Some procedures don't require any post-treatment work, and those treatments are covered by insurances. Medicare, managed Medicare, private insurances all have a guidelines to cover these conditions because insurances don't want you to deteriorate and have much worse problem.
Yeah, that was actually the next question about the insurance. So you answered that for me. Doctor, thank you so much for joining me this morning. And tell me more about the vein disease and the treatment and the procedure to take so that it doesn't get deadly. Thank you.
Thank you very much. Thank you for inviting me.
Of course. All right, USA Vein Clinics is located on North Oak. Their website and phone number are on your screen. Get treatment today and take control of your life again.